An envelope from the hospital. You tear it open. $4,200 for a 3-hour emergency room visit. You didn't have surgery. You didn't ride in a helicopter. You sat in a chair, waited 2 hours, saw a doctor for 11 minutes, and got sent home with ibuprofen. $4,200 for ibuprofen in a waiting room. And here's what nobody tells you. That number on the bill, it was made up, not calculated, not based on what your care actually cost, invented. The hospital billing system runs on markups that would be illegal in almost any other industry, and they're counting on you not knowing that. Over 100 million Americans carry some form of medical debt right now. That's roughly 1 in 3 adults. According to the Kaiser Family Foundation, about 41% of American adults currently owe money from medical or dental bills. And it's not just uninsured people. More than half of adults with medical debt have health insurance. You did everything right. You got the coverage. You paid your premiums, and you still got wrecked by a bill you didn't expect. That's because health insurance in America was never designed to cover everything. Deductibles average over $1,700 for individual plans. Copays stack up. Out-of-network charges hit without warning. So you leave the hospital thinking your insurance handled it. Then 3 weeks later, that envelope arrives, and it's always more than you expected. Always. The system was built this way on purpose. Hospitals set their own prices. There's no standard menu. The same MRI can cost $400 at one facility and $2,500 at another in the same city. Nobody posts prices at the front door. You find out what it costs after you've already received the care. Try that at a restaurant. Imagine eating the meal first, and the waiter slides you a bill for $4,000 afterward. You'd walk out. But with hospitals, you can't. So how does a hospital decide what to charge you? Every hospital has something called a charge master. It's basically a giant internal price list, thousands of items, every bandage, every blood draw, every minute in a room. And here's the problem. These prices aren't based on what things actually cost. They're inflated massively. A bag of saline solution, the saltwater IV they hang on the pole, cost the hospital about $1 to buy. Your bill shows $300 to $700 for that same bag. That's not a typo. That's the system working exactly as intended. Hospitals inflate these prices because of how they negotiate with insurance companies. Insurance companies never pay full price. They negotiate discounts, so hospitals raise the starting price, knowing it will get cut in half or more. It's like listing a house for $600,000 because you know the buyer will offer $350,000. The problem is, when you don't have insurance, or your claim gets denied, or you hit your out-of-pocket max, you get charged the full inflated price. The sticker price nobody was ever supposed to pay. That's the charge master rate. And according to a Johns Hopkins study, hospitals charge an average of 3.4 times their actual cost. Some hospitals charge 10 times or more. You're not paying for healthcare at that point. You're paying a markup designed for a negotiation you were never invited to. There's more. Hospitals also use something called facility fees. That's a charge just for walking through the door, not for treatment, not for the doctor's time, just for being physically present in the building. These fees can add $500 to $1,500 to your bill before anyone even looks at you. Let's break down a real emergency room visit. You twist your ankle playing basketball. It swells up bad. You can't walk on it. You drive to the nearest ER. You walk in. They check you in. You sit in a waiting room for 90 minutes. A nurse checks your blood pressure and temperature. That takes 4 minutes. A doctor comes in, looks at your ankle, orders an x-ray. The x-ray takes 10 minutes. Doctor comes back. It's a bad sprain, not a fracture. They wrap it in a bandage, give you a prescription for an anti-inflammatory. You're out the door in 3 hours total. Now let's look at the bill. Facility fee, $1,100. That's just for being in the building. Physician services, $480. The doctor spent maybe 15 minutes total with you. Radiology, the x-ray, $620. Nursing services, $237. Medical supplies, the bandage wrap and the ice pack, $200. Grand total, $2,637. Now let's look at what this actually cost the hospital to provide. The x-ray machine is already paid for. Running one image costs about $25 in electricity and technician time. The bandage and ice pack, maybe $8. The doctor's time at a salaried rate for 15 minutes, roughly $75. Nurse time, about $32. Overhead for the room and bed for 3 hours, approximately $150. Real cost to the hospital, about $290. The average hospital charges $2,637 for an ER visit, but the actual cost of care is closer to $640 when you include administrative overhead. That's a 312% markup. And here's what makes it worse. According to a Consumer Financial Protection Bureau report, roughly 80% of medical bills contain errors, duplicate charges, services listed that never happen, wrong billing codes. That $2,637 bill might include charges for things that were never done to you. And if you never ask for an itemized bill, you'll never know. Most people don't ask. They either pay it slowly or they ignore it and it goes to collections. Either way, the hospital gets paid. So who actually makes money when you can't pay your hospital bill? First, the hospital itself. Nonprofit hospitals receive massive tax breaks. In exchange, they're supposed to provide community benefit, including financial assistance for patients who can't afford care. But according to the Lown Institute, 77% of nonprofit hospitals spend less on charity care than they receive in tax breaks. They take the benefit. They don't pass it along. Second, the debt collection industry. When you don't pay a hospital bill within 60 to 120 days, the hospital often sells your debt to a collection agency. They sell it for pennies on the dollar. Your $2,637 bill gets sold for $150 to $250. The collection agency then comes after you for the full $2,637, even though they paid a fraction of it. That gap is pure profit, and they are aggressive. Calls at all hours, letters designed to scare you, threats about your credit score. Third, credit reporting drives behavior. Before 2023, medical debt appeared on your credit report and could destroy your score. That pressure pushed people into payment plans with interest or into borrowing money to pay medical bills, which created new debt. This is a pipeline. The hospital overcharges. You can't pay. The debt gets sold. The collector profits, and your credit suffers, pushing you further into the system. Every player in this chain benefits, except you, the only person who actually needed medical care. The biggest objection you hear is, you can't negotiate with the hospital. That's just what it costs. That's wrong. You absolutely can negotiate, and hospitals expect it. Here's your step-by-step plan. Step 1, request an itemized bill, not a summary, an itemized bill. Every single charge listed individually with billing codes. Call the billing department and say those exact words. When you see line by line what they charge, you can spot errors. Remember, 80% of bills have them. Look for duplicate charges. Look for services you didn't receive. Look for vague line items like miscellaneous supplies at $400. Challenge every line that doesn't match your memory of what happened. Step 2, ask for the hospital's financial assistance policy. Federal law requires nonprofit hospitals to have one. Many will reduce your bill by 50% to 100% based on your income. If you earn under 200% of the federal poverty level, roughly $30,000 for a single person, you may qualify for a full write-off. Even if you earn more, sliding scale discounts exist at most facilities. You have to ask. They will not offer. Step 3, negotiate a cash pay discount. Hospitals prefer cash because it avoids insurance processing costs. Tell them you'd like to pay directly and ask for their self-pay rate. This alone can cut 30% to 60% off the bill. Step 4. If the bill is already in collections, know your rights. Under the new credit reporting rules effective January 2023, medical debt under $500 no longer appears on your credit report. The 3 major bureaus removed it. Millions of Americans are still paying collections on debt that literally cannot hurt their credit score anymore. Nobody told them. And if your debt is over $500, you can still negotiate with the collection agency. They bought your debt for pennies. Offer them 25% to 40% of the total. Get everything in writing before you pay a single dollar. 2 people, same city, same ER visit, same $2,637 bill. Person A gets the bill and panics. They don't open it for 2 weeks. When they do, they see the total and feel sick. They call the hospital and set up a payment plan. $110 a month for 24 months. No questions asked. They never request an itemized bill. They never ask about financial assistance. They just pay. Over 2 years, person A pays $2,640, the full amount, plus the stress of $110 missing from their budget every single month for 2 years straight. Person B gets the same bill, same amount, same panic at first, but person B calls the billing department and requests an itemized bill. They find $380 in duplicate charges that get removed immediately. The bill drops to $2,257. Then person B asks about the hospital's financial assistance program. They earn $42,000 a year. They qualify for a 40% reduction. The bill drops to $1,354. Then person B asks for the cash pay discount, another 30% off. The final bill, $948. Person B pays $948 total. Person A paid $2,640 for the exact same visit. The difference, $1,692. Same hospital, same ankle, same 3 hours in the waiting room. The only difference was 4 phone calls and knowing what to ask. Person B didn't have better insurance, didn't have more money. They just had information. That $1,692 invested in an index fund earning 8% annually over 10 years grows to about $3,653. 1 hospital visit, 1 set of phone calls, a lifetime difference. You didn't end up with medical debt because you made bad choices. You ended up with it because the system was designed before you ever walked through the door. The prices were inflated before you got sick. The bill was confusing on purpose. The collection timeline was short by design. None of that is your fault. But now you know what to ask. You know what to look for. You know what to challenge. You're not someone who just pays the bill anymore. You're someone who reads every line and fights back. This is not your fault. Nobody taught you this, but now you know. And knowing changes everything.